Hello, my
Hi.
name's Andy.
Yeah.
Just going to do some introductions. So I'm the simulation coordinator for the Trust.
Okay.
Just tell me your name and a little bit about what you do.
So my name's Laura and I'm a Band 5 staff nurse at the BRI.
Fabulous, Laura. A bit of background. Have you done any simulation training at all before?
Yeah, we have some on our ward. Yeah.
Excellent, okay. So just before we begin, I'm sure people have said this to you before, but this isn't an assessment, so we're not grading you, we're not passing or failing you.
Okay.
All we're doing is we're basically just looking at something you might see in your clinical everyday life. So the important thing is that just act yourself, basically just be completely yourself. And the more you put into it, the more you sort of get out of it, so to speak.
Okay.
Just to say a little bit about the simulation, so we're going to use a mannequin this time. The mannequin itself is basically, essentially, just a lump of plastic, really.
Okay.
So if you want to speak to him, I'll be his voice. So
Okay.
you'll just hear this sort of voice from the other side, sort of floating across. And if you want to do any interactive things like blood pressure or basic obs, then there is some kit on the side, just pop the basic observations on, and you'll get it on the iPad just next to the patient.
Okay. Right. Yeah. Cool.
Okay. There are some patient notes there if you want to have a look at. If you need to escalate to anybody, then please just tell me who you'd like to escalate to, and I can tell you the results of that phone call.
Yeah.
Okay. So there is for the purposes of the simulation, a ward doctor available to you.
Okay.
If I'm not saying you need them, but if you do, just tell me whether you need them or not, and I can bring them in. Basically, and just say what type of doctor you want as well.
Okay. Yeah.
Right, fantastic. If you need to do any phone calls or anything, it's the 4-2s, but I don't want you to do it in real life. If you need to do an emergency phone call, just let me know who you want to phone, and I can tell you the results of that phone call. Okay. Just before we start, do you want to have a quick feel of the mannequin just to kind of see whether it's okay?
Yeah. Cool. So all my paperwork is
So all your paperwork's there, basically. Have a little feel. As I said, if you want to speak to him, I mean, he is quite heavy, so just think about your manual handling. If you want to, you can do whatever you want to him, don't mind. Just be aware that he is a little bit heavy. Okay. It is an electric bed if you need it.
And all my monitoring is going to appear on there.
All your monitoring is
I'm
going to
happy.
appear there.
Yeah.
You happy?
Yeah,
Fantastic.
happy.
As I said, I can be his voice if you want.
Yeah.
Okay.
Cool.
Excellent. So what we'll do now is I'll give you a little bit of patient handover, and then we'll start the simulation there. What I'm going to do a very succinct handover to you. If you repeat it back to me just so we both know that we've got the same information, that would be brilliant.
Yeah, sure, yeah.
Okay, fantastic. So what I'm going to do is, this is Colin Kirkwood. Basically, Colin, his nursing assistant's a little bit worried about him.
Yeah.
His news score has basically deteriorated, or increased quite a lot.
Okay.
So basically, his nursing assistant has gone to look at him. Looks a little bit different than what he normally is, and has come to you basically just to say, I need to have a look. Okay. So his last news score was scoring a 2.
Yeah.
He was generally okay. Respiratory fine. Blood pressure was fine. He was a little bit high on the temperature side, but there was nothing to worry about. In the meantime, his nursing assistant basically is going to you for a handover. Okay?
Yeah.
Past medical history was basically nothing of consequence. He's had a previous cabbage. He does have some asthma, but no allergies.
Okay.
Can you just repeat that back to me?
Yeah, so the nursing assistant is concerned because he's had an increase in his news score, but the last news score was 2. Past medical history is that he's had a cabbage and has asthma. And why did he come into hospital, sorry?
So he came in with a chest infection.
Chest infection, okay.
Yes.
And he had a chest infection, which is why he's in hospital.
Yes.
Okay, yeah.
Fantastic. Is there any other information you'd like to know?
I don't think so at the moment, no.
Excellent. So it's mid-morning. Your nursing assistant has literally just come to you with that piece of information. She's asked you to go and observe the patient and see what you think.
Okay, great.
Okay, fantastic.
Cool. Okay, lovely. Colin. Hi Colin, how are you?
Oh, hi. Yeah, I'm alright. I don't know, just not feeling top of the world really at the moment.
Oh really? Well, my name's Laura, I'm one of the nurses and I'm going to be looking after you.
Okay, hi Laura.
Hi, can you tell me why you're not feeling on top of the world?
I just feel a bit flushed at the moment. I don't know. Do you know that just kind of feeling just a bit peaky? I can't really explain it.
Okay, just a bit hot.
Yeah, I just feeling just a bit uncomfortable, really.
And when did this start?
Oh well, I think I was sort of fine, and it sort of I know it was dark, and I was feeling all right, and then the sun sort of came up when I was having breakfast, and I just started to feel just really rough.
So just in what, the last half an hour or?
It's last hour and a half.
Okay,
Yeah.
and just feeling a little bit of hot. Any
Yeah.
other symptoms?
Well, I don't know. Sometimes like a little bit sort of faint, but apart from
A
that.
bit dizzy.
Yeah.
Okay. What I'm going to do is I'm just going to do an ATE assessment, and that involves me doing some observations. Is that okay?
Yeah, that's absolutely
Okay,
fine.
great. Lovely. So I'm just going to put this stats probe on your finger.
Okay, thank you.
Lovely. And could I ask for a respiratory rate?
Yeah, sure. So respiratory rate is 17.
17. Okay, that's fine. My stats are 97. Okay, I'm just going to put this one on your arm to take your blood pressure. I'm sure you've had this before.
Oh yeah, I hate those. They get really tight. I don't like. Oh.
It's probably just going to go a bit tight now.
Okay.
And I'm just going to put these ECG leads on as well.
Oh, okay. Yeah, just I don't know.
You just don't feel very well.
I just can't put my finger on it. You know, I certainly.
Have you been bringing anything up from your chest at all?
Well, yeah. There's a bit of. It's a bit embarrassing. Like a bit of green, smelly stuff.
Oh, okay. All right. I'm just going to take your temperature.
Yeah. Okay. And temperature comes back as 38.1.
38.1. Okay, so that's a little bit high. Respiratory rate. Okay. And have you got any pain at all?
It's just feeling a bit tight and wheezy. That's all.
That's it. But no active chest pain or anything like that?
No active chest pain. No, I was just feeling grotty, just hacking stuff up.
Okay, but no pain at all.
No, well, not that I just feel uncomfortable. I don't know.
Okay. All right. Do you mind if I just have a little look at you under the covers? Is that okay?
Oh, yeah, go for it.
Sorry, I'm just going to
fine.
check if
So skin's fine.
Okay.
No breakages, no in the skin, no pressure wounds.
Okay. Does he feel edematous at all?
He feels slightly enlarged, but nothing major.
It's a little bit edematous.
Tiny bit, yeah.
Okay. And no sort of nasty surprises under here?
No nasty surprises,
Okay.
no fluids at all.
Okay. And when I feel Colin, what does he feel like?
Colin feels clammy, but also quite hot centrally, a little bit cold periphery.
Blood pressure is a bit low. Okay, so 1, 2, 3, 4, 5. So he's scoring 5. Okay. So I think I'd like to just talk to one of the doctors about him.
Yes, of course. Who would you like to call?
Probably the registrar.
The registrar? Yeah. So he is on the ward. He's at the nursing station.
Okay.
And he happens to be walking past your bay at the
Yeah.
moment. So if he walks past, you kind of catch him as he goes.
Okay.
Okay.
Yeah. All right. Okay. Great. Hi.
Hi, hello.
Hi. I'm Laura. I'm one of the nurses on the
Hi,
ward.
I'm Sam, one of the registrars. Nice to
Hi.
meet you.
Nice to meet you. I'm just a bit worried about one of my patients.
Sure.
They're scoring a 5, and past medical history is that he has asthma and has had a cabbage before, and yeah, I just wondered if you could come and review them.
You want me to see them now?
Yeah, if that's okay.
I mean, we've just finished the ward round, and there's about 8 outliers that I need to go and review
Okay.
first, and then I actually have a supervisor meeting in about half an hour. So I can probably come back later.
Okay. Do you know what time that might be?
Best guess would be about an hour.
An hour.
An hour, yeah.
Is there any chance you could maybe come earlier than that? Because I'm a bit worried about him.
Like I say, I've just got a lot on my plate at the moment. I appreciate your concern. If you repeat a set of obs in, say, 20 minutes, half an hour,
Yeah.
if they are getting worse, then by all means beat me. But
Okay.
I really do have to go.
Okay, so you just want me to do the obs for now? Is there
Would that be okay?
Yeah, I mean, I can do that. Yeah, that's fine.
Cool.
Okay.
Great. I'll see you later, Lauren. Thank you.
Okay, thanks. Okay. Right. So I'm just going to repeat the obs. I'm just going to go a bit tight again on your arm. Okay.
Yeah, okay. Am I allowed any water? I'm really thirsty.
Yeah, I can get you a glass of water. I'm just going to put something in your arm if that's okay.
Yeah, sure. Cool. Thank you, Laura. We're going to finish the
Oh,
simulation.
okay. Yeah, sure. Yeah.
Thank you very much. If we go through to the debrief room, we can talk about it.
Yeah, okay, great. Cool. Thank you.